As if battling cancer isn't enough, there are many practical issues to consider. Who's going to pay the bills while I'm off work? How can I get sickness benefits? Can I get assistance to pay for a carer? And if you live outside major centres, a whole range of extra challenges, like travelling long distances to get treatment, having to leave your work and your family. Well, there is help for you with travel assistance and affordable accommodation. All you have to do is ask.
Financially, it is difficult because you just don't plan for something like that. And with having to have blood tests, bone scans, in and out of hospital, there's always a gap to pay, and it does add up after a while. You just think, when's it going to stop? Why am I paying health insurance when I still have to pay out at a time when really I shouldn't be worrying about things like that? I was lucky with the school. They rang and offered to waive the school fees for me, and that helped out a lot because that alleviated a lot of our payments going there and then redirecting them to other things that we had to pay.
Financial concerns can be a major issue for people when they've been diagnosed with a cancer and they're going to have a lengthy period of treatment or even a lengthy period of being quite unwell when they're unable to perform, their normal duties, and physically they're not really feeling as well as they're used to. That can have a big impact on their ability to attend work and perform their normal duties, around the house and socially. So there can be a gap when someone comes into hospital and they've stopped working. They may receive some sickness benefits, but they haven't, accessed a pension through Centrelink or any other financial assistance, and that can be a big impact on them because they don't have the other entitlements such as, a low-income healthcare card for medications and things like that. So there can be a big gap for people if they don't have private health insurance and they're not on a Centrelink benefit. And social work can really help in that area in terms of getting the process started to apply for those benefits, organising medical certificates, and we also write letters of support for people to accompany their Centrelink application. And often people don't really know what's available to them, so part of our role is to explain to people what services are there to support them. There's also a number of funds and organisations we can access money through. Following an assessment of the individual's social and financial situation, we can access money to help pay for utility bills and things like that for patients in need.
All state and territory governments, as well as Commonwealth governments, offer a range of concessions to Centrelink beneficiaries. For example, as a cancer sufferer, you might be eligible for sickness benefits or for disability support pension benefits, depending on your situation. It's a good idea in the first instance to contact Centrelink to actually find out what you might be eligible in terms of benefits and support services. In addition to that, each state and territory government offer a range of concessions. Now, these could be for council rates, so a reduction in your council rates, a reduction on your water charges or your sewage charges. Certainly, there's various options to provide you with patient travel to and from medical appointments. I would advise you to contact your state and territory government to find out what sort of concessions you might be available for. It doesn't cost you anything, the service is free. And all state governments have a service centre where you'll be able to pop in or contact them or do some research on a website to actually look at what concessions are available to you.
When the family or individual contact us, what we want to do is have a look at their financial circumstances. There may be personal loans, there could be credit card debts, there could be mortgages. What we want to do is arrange from a manageable payment plan so they can cope with their finances at the moment. We also want to check whether there might be insurances on loans that then, because of loss of income, because of financial hardship, because of illnesses, they could actually start working it and making those payments for them. We might better put a hold on payments just for a short period of time so the family can have a breather. We want to make sure that they're linked in with Centrelink, that they're getting all their benefit entitlements, they're getting their concession entitlements, that we would look at also with utilities through Centrelink. They've got CenterPay, that every fortnight a certain amount of money comes out so that at least all the utilities are covered for. We will try to link them in with other agencies for any further assistance. But at the end of the day, what we want to achieve is a manageable financial situation that they can work at, and basically to ease the stress of their finances and maybe concentrate more on their health.
As soon as it was diagnosed, although I didn't know which way to look and so forth, and I had a look around locally, and I couldn't find any information at the local doctor's surgery or the public health office. So the next thing I had was ring the Cancer Council, and I rang them, and I was given a bit of information what they could, and they were going to send me a pamphlet on accommodation in the area, which they did, and that's how it eventuated to know what the Cancer Council can offer to me.
I think people who come from rural and regional areas of Australia have a lot of added stressors, and they may come from incredibly supportive families and incredibly supportive communities, but because of the distance in Australia and because of our scattered and diverse population, and our regional areas aren't heavily populated, some of the ways that cancer is treated can only be offered in major centres.
In the metropolitan hospitals, there are many supports available for country people, including rural liaison nurses, the nurses working in the chemotherapy or radiotherapy day centres, social workers, Aboriginal liaison, Aboriginal and Torres Strait Islander liaison nurses and officers to help with Centrelink issues or social issues as well as nursing issues. The nursing staff are a great resource for any clinical problems you might have, or even silly little questions which you're more than welcome to ask, and nurses will understand. The patient-assisted transport scheme in every state helps cover accommodation and travel costs and is worth accessing, as they can organise direct debit so the accommodation can be paid for instead of you having to pay for that and be reimbursed. When you're newly diagnosed with cancer, you have enough on your mind when you're leaving perhaps the farm or the local business, or you have children to organise for school. There's a lot to set up at home, let alone worrying about the cost of relocating for a period of time for treatment in a metropolitan area. So PATS can certainly reduce some of the workload that you have to organise and some of the costs associated with going to a metropolitan area for healthcare and for cancer treatment.
When you arrive at the hospital, there's a team of Aboriginal health workers, transport people, liaison, and we'll all be there to help you step by step. Remember, you're not alone, and we're all here to help you, and all you have to do is ask.
Services are there, and if you are not sure where to go to find those services, start with your local GP, your local hospital community health service, your local social worker who would be in the local community health service or in a regional town, and they can put you onto the Metropolitan Hospital services, or they can get you onto the Cancer Helpline or help you make that phone call. The Cancer Helpline is also a great resource for accommodation for country patients, and I'm sure most metropolitan areas have accommodation where they have an arrangement with the patient-assisted transport scheme for that accommodation to be direct debited, so that you don't have to start spending a lot of money to stay somewhere when you have enough on your mind already with your new diagnosis.
Getting travel insurance after a diagnosis of cancer can be quite tricky. And what we say when people ring us is the best way, if possible, is to probably get a broker to do the ringing around for them, and then it's anonymous, and find out what the best cover for that individual is going to be. I think something to bear in mind is to make sure that your medical specialists are happy that you're going to travel. That's a big thing first. And once you know that, then of course, shopping around is the best thing to do.
When a patient and family comes into hospital, often they haven't thought about you know, organising a will or an advance care directive or things like that. But when somebody has quite a serious diagnosis, maybe it's something they don't want to address, but as a role of the social worker in the hospital, we do sit down with people and help them to work through that process and to talk about it and work out if that's something that they do want to organise. So we provide people with, you know, information and booklets on preparing wills and the process for that, and also in terms of organising power of attorney and medical power of attorney, which can be very helpful for family members when, as a patient, you may become more unwell and unable to, you know, get to the bank and handle your affairs yourself or make decisions about your medical treatment. It can be very helpful for your family and loved ones to have something legal in place to help them to take care of those aspects for you. And a relatively new thing, which is becoming more popular, is to plan for the future in terms of organising an advance care directive, which you fill out when you're well and able to make decisions about what you would want to happen medically in the future if you are unable to make those decisions yourself anymore. So it gives your family and your loved ones a clear idea of what sort of medical treatment you would want and your hopes for the future, so that if you're unable to verbally communicate that, it makes it a lot easier for your family to carry out your wishes. So as a social worker in the hospital, we would help people through that process.
That's the hardest part, is having Gloria down here stuck in a room all day waiting for me to have treatment and then come back, and it gets a bit boring for her, I think, but it just can't be helped.
We'll survive.
For more information about this chapter, use the resources on this page. You can pause the DVD to give you time to write down the details.